Welcome to our Inclusion Health podcast series.
In this series, we are focusing on the voices from the margins.
I was actually homeless and I didn't have a medical card, so I couldn't see a doctor. And I could see a doctor if I had the money, but I didn't have the money because I was homeless. And when I did have the money, I was in addiction, so it was just very difficult.
When I came here and was trying to figure out how it all works and etc., what helped me is the beliefs that I had. Some of them is that I cannot give up. Another one is I promised to my husband that I have to live this life for two of us. And strong belief that I managed once, so I can manage the second time once again.
In Roma community with mental health is very difficult because some of the Roma people, they are epileptic or they have mental stress, and for these things it's not easy to go to share this information because some of the Roma people, they don't have translator, and when they go to the hospital or they go to the MGP, they don't like to share this information in front of them friends.
From a nurse perspective, a Roma family, the health education you would need to do would be really, really different. So Roma families would have a different way with newborn babies. For example, with measles, a Roma family may believe that the child should be kept really, really warm and should wear red clothing to help protect against measles. Whereas in Ireland, we'd be like, no, there's a vaccination that can really help with that. The health information I'd give to an Irish mummy who could speak English or who could read is very, very different than the information I need to give to that Roma mummy.
I have found families who are maybe middle-class families for whatever reason, they find themselves in homeless accommodation and it's a huge shock to their system. They really find it very difficult to cope because they've been used to a much better life. Whereas the people that are probably with addiction problems, alcohol, mental health, they have much better coping strategies when it comes to being homeless.
It's like the perception, most people when they first come into homelessness are crying, they're nervous, they're shaking. And then when they come in and they're here for a day or two, they realise that it's not the horror stories that they hear outside. There is good news to the horror, it's not all bad.
I think people stick their nose up to addicts, people didn't wake up and say, I want to be an addict when I grow up. That didn't happen. Do you know what I mean? It just ended like that because either trauma, the family home, or bad stuff happened to them and drugs became a coping mechanism. And what happens is then you're in oblivion. Before you know it, you're full-blown in addiction.
Inclusion Health Podcast Series 2, where we hear the voices from the margins, will be launched on Monday, February the 17th. You can find it on Spotify, Apple, YouTube, or wherever you get your podcasts.